Hello everyone, my name is Kieran Ziegenfuss and welcome to our podcast, An Introduction to Medicare. This podcast is brought to you by the Pennsylvania Healthcare Benefit Solutions Program as part of its Understanding Medicare series. PHBSP is a nonprofit service agency that helps people navigate through the complexities of programs like Medicare and Medicaid in the private health insurance marketplace. We provide individual counseling and patient advocacy services, and we produce community education presentations like the one you're watching now. So let's get started. What is Medicare? Medicare is a crucial component of the American healthcare system, providing coverage for a wide range of medical services, including hospital stays, doctor visits, preventative care, and prescription drugs. It's designed for people that are older than 65 and those under 65 with underlying conditions. Now let's discuss who qualifies for Medicare. Generally, you're eligible for Medicare if you're 65 years or older and either a U.S. citizen or legal resident who has lived in the United States for at least 5 consecutive years. Additionally, individuals under 65 may qualify if they have ALS or end-stage renal disease. Once you've determined your eligibility, the next step is enrollment. Most people are automatically enrolled in Medicare Part A, the hospital insurance, and Part B, the medical insurance, when you turn 65, if they've already been receiving Social Security benefits. If you're not automatically enrolled, you'll need to sign up for Medicare during specific enrollment periods. However, navigating the Medicare enrollment process can be challenging, especially for individuals who face linguistic barriers. Language differences can make it difficult for some individuals to understand the enrollment requirements, deadlines, and coverage options available to them. To address linguistic barriers, Medicare offers resources and assistance in multiple languages. This includes translated materials, multilingual customer service representatives, and interpreter services. Additionally, community organizations and advocacy groups often provide support and guidance to individuals facing language barriers during the Medicare enrollment. Medicare Part A provides coverage primarily for inpatient care. This includes hospital stays, skilled nursing facility care, hospice care, and some home health care services. It's important to note that while Part A covers many hospital expenses, it doesn't cover everything, such as private duty nursing or a private room, unless it's medically necessary. Each calendar year, you can earn 4 quarters of coverage by paying Medicare taxes. Once you accumulate 40 quarters, typically achieved through working and paying Medicare taxes, you qualify for premium-free Part A coverage. For example, if you or your spouse worked and paid Medicare taxes for at least 40 quarters or 10 years, you are both eligible for premium-free Part A coverage. If you do not meet that requirement, you'll have to pay the Part A premium based on the table. Regardless of premium status, enroll when eligible to avoid penalties. Moving on to Medicare Part B, this part covers outpatient care, including doctor visits, preventative services, durable medical equipment, and some home health care services. Similar to Part A, Part B has a premium. The standard Part B premium amount may vary each year and is typically based on your income. Most Medicare beneficiaries pay a standard premium set annually by the Centers for Medicare and Medicaid Services. Higher income individuals may pay an extra amount called IRMAA based on their income from 2 years prior. For example, if you're paying premiums in 2024, your income from 2022 is assessed. Additionally, late enrollment or disability status may affect premium accounts. Keep in mind factors like Medicare, Advantage enrollment, or state assistance programs can impact premiums. Now let's discuss Medicare Part C, also known as Medicare Advantage plans. These are private health insurance plans that offer the same coverage as original Medicare, Part A and Part B, but often include additional benefits like vision, dental, and prescription drug coverage. Let's talk about advantages and disadvantages. Cost predictability. Medicare Advantage plans often come with out-of-pocket maximums, providing cost predictability and financial security for beneficiaries. Convenience. These plans typically bundle hospital and medical coverage in one comprehensive plan, offering convenience and simplicity in managing healthcare needs. Additional benefits. Medicare Advantage plans may include extra benefits not covered by original Medicare, such as gym memberships or telehealth services, enhancing overall wellness and accessibility to care. Coordinated care. Many Medicare Advantage plans offer coordinated care programs that help to manage chronic conditions more effectively, leading to improved health outcomes and quality of life for beneficiaries. Disadvantages for Medicare Part C. There are some disadvantages to consider. Network limitations. Medicare Advantage plans often have network limitations requiring beneficiaries to use specific healthcare providers. This may limit choice and access to care, particularly if preferred providers are not in-network. Coverage rules. Plans may have coverage rules like prior authorization and referrals, which can be restrictive and add complexity to accessing care, services, or specialists. Geographic limitations. Some Medicare Advantage plans have geographic limitations, which may impact access to health care for beneficiaries who travel frequently or reside in multiple locations. Higher out-of-pocket costs. While Medicare Advantage plans may offer lower premiums, beneficiaries may face higher out-of-pocket costs for certain services, such as copayments or coinsurance. Changes in benefits. Medicare Advantage plans can change their benefits and networks annually, potentially affecting continuity of care and necessitating beneficiaries to review and adjust their coverage each year. Moving on to Medigap. Medigap plans are an additional add-on within Medicare and are optional. They are provided through private companies and are an alternative to Advantage plans, but you cannot have both. You must be enrolled in Part A and Part B to have a Medigap plan. It picks up the remaining costs left from Part A and Part B coverage, but it does have an additional premium that is typically between $100 to $200 per month, but can be less. Medigap plans are available everywhere that Medicare is accepted. This means that there's no concern to find in-network hospitals or clinics like you would if you had an Advantage plan. Because of this, Medigap plans are ideal for people who travel frequently. You may also consider getting a Medigap if you have high medical costs or are in the hospital frequently. Another difference between Medigap plans and Advantage plans is that Medigap does not cover vision or dental. This chart shows the different levels of plan covers, represented by the number of check marks. More check marks represent more services being covered by the plan of that level. There are many different types of Medigap plans. However, most people choose between an F-level plan or a G-level plan. These are highlighted on the screen. F-level plans are only available for people who are eligible for Medicare before January 1st of 2020. An F-level plan covers the Part B deductible, but with a monthly premium that is $10 to $20 higher. A G-level plan only kicks in for costs associated with Part B once the deductible has been paid. As Medigap plans are provided by private companies, you'll need an insurance broker to sign up for one. It's important to find a broker who has your best interest in mind, rather than selling you on a plan that they'll make the most on. If you already have an Advantage plan, but wish to switch to a Medigap, you can do this freely in the first 6 months of being enrolled in Medicare. If this 6 months has passed, you are still able to change, but you'll have to undergo underwriting. This is where insurance companies evaluate your health and medical history to determine your eligibility for coverage. Moving on to Part D. Part D is an optional component of Medicare. It's also known as the prescription drug plan. It covers a lot of medications that you pick up at the pharmacy. Part D plans also have an associated monthly premium which varies between plans and income from 2 years ago. Premiums can be as low as 50 cents or up to $100, but most are under $30 a month. Part D has a deductible that you'll need to pay, and after it's paid, your medication costs will decrease. This cost will stay the same until reaching the coverage gap, or donut hole, where your insurance covers very little of the medication costs. You will be in this donut hole until you pay out of it. This can cost thousands of dollars. If you do pay enough to get out of the coverage gap, then you'll get to what's called catastrophic coverage, where all prescription costs except the monthly premium are completely covered for the remainder of the year. Starting in 2025, the maximum cost to the patient will be $2,000 before this catastrophic coverage kicks in. Part D plans vary in what medications they cover and at what cost, so it's important to find the plans that best fit your needs. On Medicare.com, there's an easy-to-use form that you can fill out to find what plan works best for you individually. Each year, you're able to enroll in a plan starting October 15th until December 7th, but there are some situations where you can enroll outside of this time, such as losing Medicaid coverage or moving to a new state. You're able to sign up for a Part D plan without an insurance broker. You can apply online or on the phone. So that ends this presentation. Thank you so much for taking the time to watch. We hope you enjoyed and found it informative. If you would like to know more about our program and access our other podcasts, please visit our website at phbsp.org. And please feel free to reach out to us if you have any questions or concerns about your healthcare issues. You can reach us by calling 412-266-8322 or by visiting our website and leaving a message on our contact page. Thank you and have a great day.